some of the common myths that you actually see every day. If I keep trying, it'll actually work. I know that I can get it even though I'm 45, I can get pregnant. I know my mom got pregnant at 50, so I can get pregnant too. So therefore, age is the biggest factor you see that comes up. And you end up having people or women who feel that there's all these things that they can do if they have the right diet, the right education, the right things, and they can always get pregnant. And the reality is just that sometimes biology is not something that they can actually overcome. The other thing that they consider is, well, are there, supplements they can do to treat specific disorders? And yes, there's influence and there's actually support that you can get, but many times it isn't. You're going to need some sort of medical intervention. More specifically, when it comes to basically doing something like, surgery for tubal disease. Tubal disease is a common reason to need to go through IVF because, before you could do tubal surgery, have an increase for having like an ectopic pregnancy. That's a pregnancy that's outside the uterus, and that could actually basically influence and actually cause a lot of detriment to that person's life. Whereas if you went through IVF, the chance of success actually goes a lot, it's a lot lower because you can get a pregnant, they're putting it inside the uterus, so it bypasses that effect. So having, massage therapy for tubal disease or having, Reiki therapy for tubal disease are all the common things that you might hear about or think about. One thing, especially in the Central Valley, you might actually hear is that there are people who actually have a lot of basically, misinfluences about, basically certain things that cause either male problems or female problems, and people will turn to a lot of different individuals for help. The reality is, my point is getting as much information as possible. Getting the lab testing that you need to confirm about the egg quality. Getting information about sperm to know what you're dealing with. Getting information about the fallopian tube so you know what's going on. You can make decisions about what's the best thing to do once you have that information, but without that information, you're simply just guessing and hoping.